A lot of guys ask me, what happens to the urethra during the HoLEP procedure? It's right there running through the middle of the prostate. Is it possible to unpeel all of that material without harming or injuring the urethra? Well, I'm Dr. Austin Slade. I'm a board certified and fellowship trained urologist specializing in the HoLEP procedure. And today I'll be answering your questions on what exactly becomes of that urethra or what happens to it during the HoLEP. The first part of the HoLEP procedure is to cut the urethra circumferentially using the laser right where the prostate borders the sphincter muscle or the urinary control muscle. This part of the procedure is known as the apical release. That's where we separate the prostate or the apex of the prostate, that portion right there next to the sphincter. And doing that lets us limit the amount of torque or strain that's put on the sphincter during the remainder of the procedure. Let's see what that looks like in real life. Here the laser energy is seen cutting the urethra as it begins to separate that inner prostate tissue away from the outer peel. With the anatomy now better defined, that urethral incision is then extended to continue around the apex of the prostate. This will continue bit by bit around the edges of the prostate, taking care not to injure the nearby sphincter. Once the urethra has been cut or released circumferentially, I then use the laser to continue to unpeel or separate that prostate adenoma, pulp, or that's the part of the prostate here marked in red. I separate that material away from the capsule or the outer edge of the prostate, or that peel of the orange if we're following that anatomy. So you'll see here in this video how that continues to separate nicely using the laser. So here we can see that clear separation of the pulp-like material, which is the top part of the screen, separating from the capsule or the outer peel of the prostate. The laser energy really just pushes and seals that boundary between the two, so there's very little bleeding, and you can see it wants to come apart. That's a very nice aspect of this. And here we see that blood vessel getting sealed nicely by the laser, minimizing any bleeding during the procedure. So what's happening to the urethra during all of this? Well, it's right here, running right down the middle of that pulp-like material or adenoma of the prostate. While we're unpeeling along the outer edges of it, the urethra's just staying put right there in the middle. So there's not a lot of action during this portion of the procedure. So eventually, as we're working our way along the outside of that pulp or adenoma, we're going to hit the portion of the prostate where it meets the bladder. So here we do have to cut the urethra again circumferentially all the way around where that bladder meets the prostate and funnels into the urethra. This portion of the bladder is known as the bladder neck. Here I've moved along the anterior or top surface of the prostate right to the point where it meets the bladder neck, and I'm cutting through those fibers and creating that second opening I reference. And you can see the bladder in the background is that dark space. So I'm moving now circumferentially along the left side of the prostate, and then I'll swing around to the patient's right side and work this down. This continues circumferentially until there's just a little bit left at the bottom, and this is that final right segment. I've gone all the way around the bladder, cut off the final attachment, and at this point the prostate's completely released and is pushed into the bladder. So once that urethra has been released circumferentially there at the bladder neck, the prostate is then pushed into the bladder. You can see it's all there floating intact. And the urethra that was running through the prostate, known as the prostatic urethra, is now inside that piece of prostate floating around inside the bladder. It's been completely detached and is included within all of that material. So what remains, this outer shell or capsule of the prostate, that now becomes the prostatic urethra. This portion of the prostate is going to form a new lining, and this hollowed out opening is the urethra. Here's what that freshly hollowed out prostate space looks like. You can see there's nothing now in the way, all the way from the bladder, which is in the background, still with that peeled out prostate tissue there, but nothing in the way from the bladder to where the urethra starts again. As a point of reference, this is what it looked like beforehand inside that obstructive prostatic urethra, which wouldn't allow for much flow compared to the now very widely opened up prostatic space. And this is that final step of the HoLEP procedure, which is removing the prostate material out of the bladder. This instrument's called a morcellator. It shaves that prostate down into little tiny pieces, which it then sucks out of the bladder. Those pieces are then sent for biopsy so a pathologist can let us know if there's any cancer or irregularities in that tissue. So does this just now become like a second bladder, some large storage space of urine? Well, not quite. It does contract back down to the normal prostate size over the next 3 months while that area heals and the new lining forms. It will no longer be obstructive, so there is a little bit of an opening inside, but it doesn't remain this large floppy space or second reservoir of urine. Relative to the amount of urine your bladder is holding, it's very little, maybe 10 to 30 milliliters, whereas your bladder is going to be storing over 500 to 800 milliliters. Now let's see what that looks like in real life. This is a prostate about halfway through the healing process, or a month and a half after surgery. You can see a lot of the lining has started to reform. It has that nice pink surface to it, but there's still a bit of that white, filmy or flimsy scab tissue. That's the material that will be passed out into the urine for up to 3 months. This clip's now several months after the HoLEP procedure, where that inner lining has completely healed up. You'll see there's no longer any of that white, filmy scab material. It's a nice, smooth, even covering. There is a little red mark you can see there at the bottom of the prostate. That's related to a kidney stone surgery that was occurring here, not the HoLEP. Well, I hope that helped to clarify what happens to the urethra during the HoLEP procedure. It's a similar tale with other prostate procedures, only that there will often be some of that pulp or adenoma tissue behind, so it might not be just quite as smooth or elegant of a surface, and any of that pulp material that's left behind eventually can or does regrow until it becomes obstructive again and needs to be removed. Give me a follow for more informative videos on HoLEP and other BPH or prostate procedures.